Okay. So, Harry, let me ask you a question. How do you define PTSD? What is the difference between PTSD and other forms of military correctness? How would you tell a person that doesn't understand PTSD? What are some of the common symptoms you should look?
PTSD stands for post-traumatic stress disorder, and as the name implies, it involves a condition that results from extreme trauma. Now, what is extreme trauma? It's either being threatened of your own life or witnessing your buddy being threatened or hearing about a member of your family or someone else that's been threatened, or in the new DSM, the Diagnostic and Statistical Manual of what we call things, even for first responders, going over and over and over pictures and paperwork. So that can be the traumatic event. And what the trauma causes, not in everybody, actually, it's only in about 20% of those in direct combat that get the condition, but it involves 4 clusters of symptoms. The first is called unwanted re-experiencing. Things like thoughts that pop in your head, nightmares, flashbacks, triggering events like sounds, noises, like sounds, sights, or smells that might trigger thoughts. The second cluster of symptoms is called avoidance. And that's where you go out of your way to avoid thinking about the traumatic event, talking about it, watching movies or TV news about it. And the third cluster of symptoms is called negative thoughts and emotions that come from the trauma. Now, these are things that start after the traumatic experience. So if you were a jerk before it and now you're a jerk afterward, that's not PTSD. But if before PTSD you love being with people, you love going out, you are a social guy, and now you avoid all crowds and all interactions with other people, you feel guilty, your moods are always negative, you don't seem to enjoy life, the things you used to enjoy, that's negative thoughts and cognitions. And the final cluster of symptoms is what we usually think of as PTSD. It's called increased arousal. Things like not being able to sleep at night, whether you have nightmares or not, being easily startled and jumpy, always scanning around to see who might be there, not being able to concentrate very well, and the one that makes the most in the news is anger, agitation, and irritability. So those are the symptoms of PTSD.